Welcome to our feature presentation, Health in 3D. Don't worry, for this movie you won't need clunky glasses. We will take a closer look at the 3 Ds of health: diversity, determinants, and disparities. Our goal is to provide you, state or local health department employee, with answers to 3D health questions. First, what is diversity and how does diversity influence perspective? Second, what are the determinants of health and how do determinants and the choices available influence a person's health? And finally, what are health disparities and how are they obstacles to better health? As employees of a public health agency, by answering these 3 questions, we can understand better the concept of health in the big picture. We are all diverse in some way from those around us. Diversity refers to a range of human perspectives, backgrounds, and experiences. These can be reflected in characteristics such as age, ethnic origin, gender, nationality, physical ability, learning ability, race, religion, sexual orientation, and veteran status. Other dimensions of diversity include, but are not limited to, education, socioeconomic status, marital status, employment, and geographic background, as well as cultural values, beliefs, and practices.
Well, I came here as a foreign student and went to the University of Utah, the School of Social Work, graduated, got a job, and stayed, so I'm an immigrant.
My Indian name is Barui, which means the large deer, the elk, and I come from Southwest Utah. I was born in Cedar City and raised in Cedar City, Utah.
I was born in California, went to college here in Utah, and then married a man from Boise, Idaho. And after that, we have moved about 14 times, I guess.
My parents moved here to Utah in the 1970s from the island of Tonga. And so I was born here. I was the first of their children to be born here.
I moved to Utah from California, got married, 4 kids, 5 and triplet 3-year-olds.
I was born and raised in San Juan County. I actually grew up in Blanding. Went to school there, graduated from high school there.
I am actually a transplant to Utah, so I moved here in the year 2004.
My brother lived here and said, "This is the place to be. The mountains are beautiful, the people." And I said, "Where is Utah?" Over 35 years later, I'm still here.
Came to Utah like 1997. Bring my family here because this is a great place to grow the family, Utah especially. I love this place.
As you can see, there are a lot of ways people can be diverse. It's important to understand what factors can influence diversity. For example, the time into which a person is born and the political and economic experiences associated with that time period influence outcomes. The place where a person is born, such as in an urban or rural area, as well as the country, region, or climate, can shape the views of that person. Influences of family, friends, and education, formal and informal, play a big role. Even the primary language a person learns plays a role in affecting diversity. Different beliefs and religious practices, along with key people and experiences that influence a person's thinking, all contribute. Diversity is much more than just race or ethnicity. It is who we are as individuals. No 2 of us are the same. The fact is, Utah has always had a diverse history.
As you look at the development of the area of Utah and later as the area that we now know as Utah, it has been marked by a diversity of peoples. 12,000 years ago, we have evidence that there were humans in this area. Then as we go through, we see that we have around 1300 AD, a development where other peoples start coming in. There's a mix, and so that's when you get the Native American groups that we know. The Utes, the Goshutes, the Paiutes, the Northwestern Shoshone, and Navajos. the 1700s, there are Spanish explorers that come into the state. And that takes us up into the 1820s when the fur traders and trappers start coming in. Later in the 1830s and particularly in the 1840s, pioneer groups started to come in. So that's when you get Swedes, Norwegians, Danes, all of the LDS Church who were coming in to settle. Then you had the railroad that came in 1869, brought in Chinese and Irish folks. So not only did the ethnic diversity start to change, but the religious diversity started to change as well. Mining became very big, and railroads. That brought in a whole new groups of people. It brought in Japanese, the Chinese, as I mentioned, Italians, Greeks, Serbo-Croatians. And then as we go into the 20th century, that diversity continues.
Since Utah's history has been one of change, it's important to look forward and understand how diversity will influence Utah's future.
Well, Utah's at a very interesting moment because we're in the middle of a major demographic transition. And the demographic transition has really been driven by three basic factors. One is the coming of the immigrants at the end of the 1990s and into the early 2000s, and they've come from all over the world, come from very non-traditional source regions. And generally speaking, people who move long distances are young, and we notice that young people are the ones that have the children. So this is a very young and very diverse, large household sizes, a lot of languages, a lot of ethnic traditions, a lot of intellectual traditions. The second driver of demographic change is the aging of the population, and that's brought about by the aging of the baby boom. So, you know, the baby boom is this huge demographic of people that was born between 1946 and 64 and absolutely dominating the age structure of our nations for so many years. Well, you can do the math on that, and that cohort is basically approaching and entering retirement age, and it's huge demographic. And that particular group of people is very white, native-born English speaker. Those folks are born during a period of time when we had little immigration at all, and what immigration we had was from European countries. The third driver of change is differential fertility rates, and so for populations that have been resident in our nation for many generations, fertility rates have really fallen. And yes, that's true for sort of traditional Utah women too. And the new populations that have come have higher fertility rates in a lot of cases than the populations that are here. So even though Utah has a higher fertility rate than Mexico in general, the women who are moving here from Mexico, for example, have higher fertility rates than white non-Hispanic women here. So if you add this all up, what this means is that white people are old, generally speaking, have smaller household sizes, and have come from non-immigrant backgrounds. I mean, they've been here for many generations. Young people, very diverse, recent immigrants, and their kids. And of course, their kids will have kids who will have kids who will have kids. And these are all native-born Utah people, but they come from all of these very diverse traditions. The Utah of the future is very, very different than the Utah of the past. But if you go back far enough, it's really just a replication of the past, again, with a different set of players. Because our nation is a nation of immigrants, and because the West was settled by immigrants, of course, the builders of Utah were immigrants.
Utah's population is changing. It's important to understand how these changes will affect the service that we as employees of a public health agency provide. Diversity shapes the perception different people have about what it means to be healthy.
More than physical, being physically well, it's more emotionally well, spiritually well, and being healthy is when you have balance and harmony in life, and you feel good about who you are.
A lot of people believe that blindness is directly related to health, and I don't have that same viewpoint. It is something we relate as a characteristic. We believe blindness is just kind of a part of you, much like what type of hair color you have, whether you're a deep talker or high voice person, or whether you have bald baldness in your family, whether you have hearing loss or anything like that. But we don't really see blindness as a direct relation to whether you're healthy or not.
But it's really just that mental and physical ability and energy to do what we need to do every day. If I have basic health, that's what I would like to be doing, what I can do every day, but also something I will love to do.
If my money isn't right, I'm stressed out. And, you know, it just adds a whole nother level of issues that I have to deal with if I don't have the resources I need to take care of myself and my family.
In my culture, to be healthy is to be surrounded by family, spend time together, to enjoy each other's company. I mean, you can be sick, like physically sick, but still be in good health if those things are around you. And so for my parents, having good health, and for me, it means being part of the community.
It means everything to me, because if I weren't healthy, I would not be able to do all of the things that I'm able to do. I love being active.
Healthy is the good moment to be happy. And all those ways what I'm talking about, social, economic, and physical, if you are there, you are healthy.
The second D that is important for us to understand as employees of a public health agency deals with the determinants of health. Determinants of health are a basis for understanding the factors that contribute to a person's health. It is generally recognized that there are 5 major determinants of health, including genes and biology, which could include family history, whether we're male or female, and age, along with many other factors built into our DNA and physical bodies. Health behaviors like eating habits and diet, smoking and drinking alcohol. Activity levels also play a role, as do safe behaviors like wearing helmets and seat belts or having protected sex. Behaviors like these and many others influence a person's health. The social environment, including income, social status, education, and cultural background, all play a role in influencing the health of a person. Research shows that at every $10,000 step up in income, the average person's health gets better. Stigmas and many other social pressures an individual faces also contribute to the social environment. The physical environment includes factors like transportation, housing conditions, air and water quality, and all of the physical and chemical factors we are exposed to every day, often without even noticing them. And finally, access to health care. For example, does a person have access to quality, appropriate health care, a primary care provider, and health insurance? Of the 5 areas that determine our health, on average, biology and behavior together account for only about 25% of how healthy we are. The social and physical environments and access to health care determine the remaining 75%. Together, these 3 areas make up the majority of our health and are known as the social determinants of health. The social determinants of health are the conditions in which people are born, grow, live, work, and age, and include the healthcare system available to them. It's important to understand that health is not something we get at the doctor's office. Health starts long before illness. It begins with the conditions that shape our lives. When it comes to your health, your zip code can matter more than your genetic code. The conditions we live in are the foundation of our opportunities for health. The choices we each make regarding our health are shaped by the choices we have available to us.
When you live in an urban area, you usually have some options with regards to where you get your care. Living along, the Utah Strip of the Navajo Nation, which is in southern San Juan County, there for a long time really weren't any options. If you wanted health care, you had to get in the car and drive for an hour and a half. In order to buy fresh produce or, fruits and vegetables and things like that, you have to drive about an hour to a location where there's an actual store that you can buy those types of things. Water is another thing. People can't really even grow their own gardens because they don't have access to water to water their gardens.
I think we found out about 18 months that he had asthma and food allergies. Before then, him and Mason have both had really bad eczema since they were born. And then when we found out about the food allergies and the asthma, they said those three kind of link together, and typically if they have one, they have one or two of the others. His asthma, I can definitely tell he has a harder time in the colder winter months. I think it affects him more when it's winter and when the air is bad out.
First one, I don't like smoke, no cigarette. Around the family, I try to be in the right place. And one of the things is no alcohol, and good relationship with the neighborhood. That's another one. That's so important.
Well, for me, one of the first things I had to deal with in Utah was not having an African-American physician or anyone that looked like me at the doctor's office. And I think that in itself can be a barrier for people seeking health care, because we often look for someone. It's a challenging situation going to the doctor, because we're usually not going because we feel great. We're going because something is wrong. And then to be able to have a conversation with a total stranger, and then someone that you may not feel can really relate to you.
When we understand that 75% of what determines our health comes from our interaction with society, including our income, education, and status levels, as well as where we live and how much access to health care is available to us, we begin to understand what the third D, disparities, is all about. Health disparities are differences in health outcomes between groups that reflect inequalities. Health disparities negatively affect groups of people who have systematically experienced greater social or economic obstacles to health. These obstacles stem from characteristics historically linked to discrimination or exclusion, such as race or ethnicity, religion, socioeconomic status, geographic location, gender, mental health, or sexual orientation. A population experiences health disparity if there is a significant difference in the overall rate of disease incidence, prevalence, morbidity, mortality, or survival rates in the population as compared to the health status of the general population. Although the term disparities is often interpreted to mean racial or ethnic disparities, many dimensions of disparity exist, particularly in health. If a health outcome is seen in a greater or lesser extent between populations, there is disparity. Demographic factors that influence the presence of health disparities could include race and ethnicity, geographic location such as rural or urban, gender and gender identity, sexual orientation, disability status, or special healthcare needs. Factors that may reduce health disparities could include access to a quality education, nutritious food, adequate safe housing, adequate secure working conditions, affordable reliable public transportation, culturally sensitive healthcare services, health insurance, clean water, and non-polluted air. Disparities are determined by the obstacles a person must overcome to be healthy and achieve their health goals.
So when I was young, in my young age, we never had health care services provided to our people. And a lot of our people died off because of it. And when we gained federal recognition as a tribe on April 3rd, 1980, we were losing 3 tribal members to every birth in the tribe. So we were literally going extinct. Nobody could afford health care. My people were working low-paying jobs, labor jobs, and they were underemployed, and no one could afford to go in to see the doctor. So they tried to treat themselves with their own herbal medicines, and so a lot of our older people and our young babies died off during that period.
A lot of the programs have not been checked and built with accessibility in mind to the blind, so where they might just have an image up on a website. Well, I use a screen reader. It talks to me. I manipulate the keyboard. I don't obviously use a mouse because I have no need for a mouse, but I manipulate the keyboard using keystrokes and find when I need to. And I listen. And if it's just labeled as an image, well, I don't know what an image is until it tells me what that image is.
The concern with all the oil wells and the natural gas wells that are, especially in the Montezuma Creek Gannett area, they're everywhere. So the problem is not just finding out if there's water available, but accessing the water and making sure it's not already contaminated.
One time I have an emergency, and I went so hard. I broke my toe, and I went there because it's painful. And the first thing, I know this is the rules from the hospitals. The first thing, they had to fill it out, all your information, if you have insurance, if you have everything, like they think before economic things. They show to you not too much interest in your pain. And that hurt. That makes you feel like you are not they are not taking too much care about you.
I think from a cultural perspective, being able to change our diet, those things that we grew up with, because that's what we had. We didn't have a choice. So one of the big challenges many of us have is getting away from those flavorful, wonderful tastes that you grew up on and finding more creative and healthy ways to substitute things for that. So learning to use smoked turkey versus ham.
At our doctor's office, whenever we go in for a sick visit, we never see our doctor. We never see our doctor unless it's a well child visit. And I feel like I really think that's inconvenient for me, because every time that I see a new doctor, I have to go over our entire history and kind of bring them back up to date. And then I feel like they don't trust me as much as a parent because they don't know me. You know what I mean? And so they kind of second guess what I think is going on with my child, and then they don't trust me.
After understanding the 3 Ds of health, diversity, determinants, and disparities, the real question is, where do you fit in as an employee of a public health agency? It doesn't matter if we are frontline clinical providers, or that we work in data, administration, finance, health promotion, environmental health, public information, human resources, or preparedness. It is critical that we all understand the connection between diversity, health determinants, and health disparities, because directly or indirectly, we all work in public health. So how do we do all of this to improve the health of all Utahns? By putting our 3D vision into action with these questions. First, we recognize the role of diversity in those we serve. We ask, what is this person's perspective? By putting ourselves in the other person's shoes, we can work toward better health outcomes.
I think sometimes as modernized as the people become, when they're faced with a difficult situation, it's just more comfortable to them to revert to the cultural ways that they grew up knowing.
It's kind of weird because I grew up here in the United States, and so I know, there's a certain definition of what healthy looks like because I see it in the magazines, but culturally it doesn't make sense to me. It doesn't really make sense at all. And so, when I see those things and then experiencing my own family experience, I went to the doctor probably a week ago, and what I find interesting is they can tell me the same stuff and I get it, but I don't think they really understand who I am or the way that I look at my life and what I value as being important. I think that they look at it as, you need to do this in order to be healthy and happy, but for me, my definition is not the same as theirs.
As I've watched my mother, it's kind of like a precursor for me, and I want to make sure that I don't get there. Yeah, I was out walking day before yesterday, and my dog started to run, and I was able to run with him. And somebody passed me, and she said, "Wow, you're really spry." And I thought, somebody would only say that to somebody that's old.
Second, when we ask ourselves what choices are available to this person, we understand better the determinants of health that are influencing the individual or community we are working with.
It's hard, especially when you start with no English language. This is my second language. I adopt that one. But it's hard to us to come to a place where you don't know many things, rules. So start kind of like hard. But like I say, it's a dream.
A lot of people ask me, what are the places that are the hardest for you to go as a blind person? Number one is airports, and number two is hospitals. Those two places, I seem to get grabbed and pulled and yanked anywhere in those types of facilities. If I have a person that gives me proper directions, tells me, gives me a good idea of where something is, I can definitely find it on my own. I have the skills to be able to do that.
Our insurance is terrible, and so we definitely try to avoid the doctor as much as possible because it costs so much money to take our kids to the doctor, which is, I think, really sad. You know what I mean? That we don't feel comfortable that we can take our kids in unless it's something serious.
Accessing healthcare is very difficult because of everything about the insurance, about this. It just blows my mind. It's like, what the hell is this, you know?
Finally, it is critical that as public health employees, we ask ourselves, what obstacles must this person overcome to be healthy and achieve health goals?
The blindness is just something I have that's a part of me. And I could choose to see it as a tragedy and see it as a part of me that almost has more of a negative connotation where I don't leave my house much, or I wait for somebody else to do something for me or things like that. Or I can decide to tackle the challenge of being blind, and that's what I've chosen to do.
Where immigrants came here to the United States to work, and we worked so hard. We don't take care of ourselves. Why? Because that time we need to be working. For what? For stay here to pay bills, to pay everything.
Instead of looking at symptoms, because we are looking at symptoms and treating somebody, getting a story is important. I think getting a story, because you're able, through the story, to get a perspective on the way that they view their health, and so I think for a professional, asking the right questions, and what those questions are would be related to getting a little bit more acquainted with the story.
By recognizing the disparities that negatively impact the health of individuals in certain groups, we can proactively work toward better health for all Utahns. So remember, use your 3D vision when serving individuals or the community by asking yourself, 1. What is this person's perspective? 2. What choices are available to him or her? And 3. What obstacles must this person overcome to be healthy and to achieve his or her health goals? By being mindful of diversity, determinants, and disparities, we can fulfill our mission of improving the health of all Utahns and making Utah the healthiest state in the nation. Thank you for your commitment to making this happen by looking at your job in 3D.